First restorative thing that we do is we do tooth-colored fillings. Some people call that bonding. We can do that for small areas of decay. We can do that to hide discoloration, to change shape. There's a lot of things that we can do with bonding. Whenever I talk about bonding, I remember as a kid I broke my front tooth, and I went for a period of time where it wasn't fixed, and boy, it was great to have that corner filled back in, because a lot of it was broken away. Bonding is very good, provided there's enough tooth structure. I tell people filling, you need a healthy tooth to pour filling into, so you sort of need a structure to pour it into. Now sometimes when the tooth is really broken down, you might need to go to a crown, and a crown, you'll take a kind of broken down tooth and you'll surround it with something that's hard, that can support it and take some punishment, and we put porcelain over there and it can look very real. And inside your mouth, it feels like your tooth.